and welcome to Mind Matters, the podcast where we talk about everything concerning mental health, substance use, and what we're doing in our community. I'm so happy to have you here with us today. I'm going to introduce myself first. I'm Wendy McCarty Van Bemmel. I'm the Regional Director of Universal Health Services in our 4 facilities here in Central Florida. And to my right, I'll let you go ahead and go, Shani.
Hi, I'm Shani Sloan. I'm our Community Outreach Liaison at University Behavioral Center. I am also a person in long-term recovery.
I'm Douglas Stedfelt. I'm with Palm Point Behavioral Health. I'm Director of Business Development.
Nice to meet you all. I'm Dr. Evelyn Higgins, specialty in addictions and compulsive disorders.
Awesome. Thank you guys so much for being with us today.
Thank you.
Thank you.
We're going to have a great conversation about substance use and our roadmap to recovery, what that looks like. Kind of just delve right in and talk a little bit. I'm going to ask you first, Dr. Higgins, can you talk to us a little bit about substance use, substance misuse, addiction, and how do we know what we're working with?
Sure, great question, because that's probably where a lot of people find themselves. Where am I in that spectrum? And it's all spectrum, right? So use, socially, recreationally, with no negative consequences. Misuse, you're trying to self-medicate something without going to that place that you need to work on of why you're self-medicating to begin with. And then by the time we get to addiction, there's negative consequences to our behavior, yet we continue that behavior.
That makes total sense. Now, I've heard this term quite a bit lately, California.
Right, sober.
Yeah, California. What is California sober?
Smoke weed.
Have you all heard that term before?
Yeah. And in California, it's a real concept. And for a lot of people it is, and probably don't want to get started in that quick into the podcast, but with the legalization of medical marijuana in so many states, there is kind of this gray area. Well, it's legal now, so therefore, I'm like, no, it doesn't mean you need it or should be using it, right? If you have to self-medicate, there's a problem, and we need to find out that why. We're not healthy one day, sick the next. Same thing when it comes to mental health and addiction. We're not healthy and then addicted. It's all of that living in between that brings us to either end of that spectrum.
That makes a lot of sense. Yeah, totally. So for someone who's maybe listening to our podcast today and you're kind of curious, do I have a problem? Do I not have a problem? Do I need to seek professional help? Do you have any guidelines on where to even begin?
Sure. If you're saying to yourself what I call the honesty inventory, if you're being honest to yourself and you say, I think I have a problem, you probably do.
Okay,
right?
That's a good start.
That's
a great start.
Saying, I may not be at that point where I want to tell others, my friends, my family, but inside there's this nagging, bloop, 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 there's a problem going on. That's the first part, being aware of that. And that's the beauty of our internal, listening to that gut, right? Our second brain, our gut. So listening to that, what it's telling us, and then say, all right, what kind of help do I need? Where is it that I need to go for this help?
Yeah, and that can be a pretty scary,
daunting.
Yeah, when you've got that little gut wrench in your stomach, and you're like, no, not me. I'm good. I'm good.
Right, and you convince yourself of that. Today's Friday, so the weekend, it's like, I go out and party, and then Monday morning, why did I do that?
Right.
But by Wednesday, you're back in the saddle. We're good. Everybody else was doing it. You tell yourself every reason why it's okay to keep on doing it. And it's not. If that's, if there's negative consequences in your life, or even just that nagging of probably shouldn't be doing this.
Yeah, it doesn't feel right.
Yeah.
Have any of you guys ever heard the term of social acceptability does not equal normalcy? Especially when you brought up the legalization portion, for me, especially when I think of addiction for me as a disease, like a neurological condition where outside stimuli is needed to fill that void within, whatever that may be, emotional, spiritual, physical.
Yep.
And especially as, I struggle with chronic pain. There's many times where medical marijuana has sounded like something that may help, but for me and the way that I had used substances, I know I wouldn't be capable of just using it as prescribed or as the way that it should.
Right.
There is a population that can.
Right.
It's the same thing with alcohol. Even that's why a lot of people who come into, especially our detox facility, a lot of times with alcohol, we don't see people come in until 50s, 60s even, because those consequences, the real life consequences, may not happen ever.
Right.
But the physical consequences happen after that prolonged use.
Yep.
So even though they're binge drinking once a month for 6 days at a time, that for 20 years turns into liver cirrhosis, alcoholic fatty liver. There's so many complications that we don't necessarily see them until the use gets to a point where there isn't necessarily a medical return from it.
Sure. And what about that person that only says, okay, now it's time to go get help because their spouse told them or their job told them, right? Mm-hmm. Yeah. Very similar situation.
We see that a lot. And then you're either forced to get help and you've got to come to terms with, am I going to do it for myself?
Right.
Or, am I not? And that's a very difficult
And it
choice
doesn't
to
even
make.
discriminate either. And just such a age group, it's all across the board, and even ethnicities as well too. And
absolutely.
that's such a huge factor as to like how you grew up and your background. And
Right.
I think that's a big factor that plays into it.
Every zip code. People like, it doesn't go on here. Yes, it does. Yep. I'm here to tell you, yes, it does.
Yeah. I mean, we see it in the news. We see it with pop culture celebrities. We see it in our own families.
Right.
Yeah.
Okay, look at, what was it this week? Pete Davidson had said he just came out of rehab for the whatever time, and he was using ketamine daily for the last, it was 2 or 3 years. With all of these ketamine clinics popping up all over the place, people are like, well, it's ketamine. It's good for you. I can go get it anywhere.
Yeah. I saw a commercial of someone that looked like me doing it and going about their day.
Right, exactly.
Yeah, so
You
it's
can go
great.
to smoke shops, buy Delta 8 or Kratom, but there's times where we've had patients come in, they're like, I'm only doing Kratom from the smoke shop, and they pop positive on a drug test for fentanyl. And there's realization of there's no surefire way to prove that what you're using is what you're using. And if you're willing to take that consequence without thinking about the personal part of it, of like, I'm willing to use the substance because I want to feel X, Y, and Z, I don't care that it might not be real, I think that's when it starts to teeter into the like full-blown addiction point. Right. I know you guys work with epigenetics, and I was going to ask how, at least your experience with the nature versus nurture part of addiction, because I know for me, huge family history, I have a predisposition to it, but I have friends who are in recovery who no one in their family has ever had a drink or drug. And so I wanted to maybe hear your perspective on nature versus nurture on that.
Sure. So both, right? Nature and nurture, they both come into play. But the epigenetics part that you bring up, Shani, is a great conversation today, because to me, it's the most exciting part of what's going on in science today. You're born with your DNA. Here's your cards, play them out, right? And we now know that what changes is the expression of that DNA. We're not going to change your DNA coding, but the expression of how that plays out can change. That's exciting. We now know that genes can get turned on or get turned off. So, how come people say, yeah, but for, 21 years, my daughter's life, I never saw this behavior. Okay. What did they do at 21? Well, they went to college. Okay. They were making their own decisions, probably the first time because you made them for them their whole life, right? Now they're supposed to be in school to learn. That's a new stressor, right? Maybe they have a part-time job. That's a new stressor. Are you sleeping? Part of college, right? You forget what you're really there for. Are you eating dense, nutritious food? All of these stressors in that person's life then turn on those genes that were always there. They just never express themselves. So it's a really cool nature-nurture part, and that piece of epigenetics is what is so exciting.
That is. So I'm listening to you and I'm wondering, so can you manipulate based on expression? Say you're getting all of these stressors, you've exposed what you're already predispositioned for, and then you start changing your eating, all the things that we have control over in our environment. Are you seeing positive results from
Absolutely. So that's what we do at Wired Biohealth, right? So we look at the biochemical pathways of each one of those biomarkers that had errors in the coding, right? That creates a polymorphism. So what's a polymorphism? The science word, and I promise the only one I'll use during this podcast, right? So single nucleotide polymorphism, that means that there's an error in the coding. That error creates what we call aberrant behavior. That's things like impulse taking, risk control, addiction, anxiety, depression. identifying those things as a first step, because then we can look at the biochemical pathways and say, okay, if we're not getting to that next step in that pathway, what do we need to do to support that? So we're really isolating where we need the help instead of guessing, or treating the 7.5 billion people in the world like they're all the same. We know that they all have their own unique sets of DNA, yet we treat everybody the same. It doesn't make sense with the technology that's evolving.
Are you doing anything with prevention or looking at younger, maybe even kids?
Absolutely.
Interesting.
That's the sweet spot.
Yeah.
That's the sweet spot. In fact, I did a TED Talk about just this, understanding the biomarkers of addiction, and I wrapped it around in a child's life. If you knew this was your genetic predisposition, would you make different choices moving along? And when I talk to kids, I'm like, here's the deal. We just did your biomarkers. This is you, right? You don't have the wiggle room. So when you're at an age now where your buddy's going to say, hey, great idea, after school, going to do this or that.
Yeah.
And then next day you're like, oh, that was good. I want to do that again. And your buddy's like, no, we're cool. We're moving on to this. You're like, no, let's do that. That's the whole part of using this. You know, families will talk about, well, we have a genetic predisposition to cancer in our family. I just want to let you know that. So when you're making your choices in your life, you're clear on that. Or cardiovascular disease, mental health and addiction should be that exact same conversation. That's what removes the stigma. Doing what you're doing here.
Yeah, 100%.
That's what removes the stigma, because it's our health. It's like anything else, but we still want to be like, no, that's not in my family. Yeah, it is.
Yeah.
I was at a chiropractic conference a few weeks ago, and one of the presentations was about how if we treated our mental health like our physical health, and like just one health, one person, whole body health, we may not struggle with the exact same issues that I feel like we're going through in society. And so, it changed when I listened to that. It changed the way that I look at some of my health stuff.
Absolutely.
And so you brought up when we were talking about adolescence, I volunteer at one of our facilities at La Amistad, and I talk to the kids about, being peer-to-peer. Hey, this is what I went through. If you can catch it now, it can be misuse. Yeah. But if you identify with what I'm saying, you should probably think a little bit further. Right. And some of the things that we get brought up pretty frequently is about, well, if it's a problem now, what about when I'm older and it's been like 6-7 years and I have this period of sobriety? Would I be able to do it again? And for me, the way that I look at it is I can deal with that when it comes to it. But the way that my life is now, when we talk about the neuroplasticity of the brain, rewiring it, essentially everything I do between, my mental health medication, keeping up with, whatever kind of recovery program that I do in my mental health professionals, and stay in tune with what's important to me, the more that I find I'm seeking good things in my life. Right. And so when we look at the neuroplasticity, when people really dive into their recovery and what that looks like for them, even if it's harm reduction centered, it changes the way that someone actually responds to things. It changes, like I brought up before, it changes our body chemistry. So why wouldn't addiction change our neurochemistry?
Exactly, and it does. Yeah. And great that you're working with young people. We had a great case of a young person. We actually used it at the international conference as our case study in Abu Dhabi last year. The girl is 7 now. Parents, she was in the foster system, adopted, born of an addicted mom, coded 3 times in the hospital as a baby.
Wow.
Came out, lots of problems. She starts school. We're already seeing that who she is, coming out, and she's being transferred to schools, and it's already a problem. Parents come to us. We worked with her unique self in every single way, and put her on a protocol at the end of the year. Still, I'm getting goosebumps as I say it. At the end of the year, she got the character award for school.
That's amazing. Beautiful. That really is.
And you think about the long-term effect of that, not just her life, but she was only 5 at that time, now 7. So the amount of people that she's going to touch in her life as a result of now being who she is, amazing.
I have chills too.
Yeah, that's where we make the differences.
I love that.
Yeah.
I think for, those listening today that are parents and evaluating, does my kid have a problem? Like, do I need to seek help for them? I think this is clear evidence that getting help early makes a world of difference. I think even knowing, like we were just talking about, knowing your predisposition going into college, like with that in your back pocket, knowing that equips you in a different way.
Yep. And it's so normalized, especially in the college environment, right? Or, we're going out drinking, or we're going to go, do whatever, X, Y, Z. And it's normalized, where today, you have to make excuses for not doing that and it being okay.
Yeah. I think there's some, I've noticed a little bit more lately. Like you'll see a mocktail list on a menu, or, it's pretty cool sometimes to be like, I don't drink, or, we're seeing celebrities say that I'm 3-4 years, whatever it may be. So I'm hoping that trend continues.
Exactly. And when you see, to your point of like the mocktails, the big hotels and restaurants that are making more of a to-do about that mocktail list, that's really good. And when, celebrities or successful people say, hey, I'm sober for this amount of time or whatever, like, wow, that person's really doing well in their life. That's somebody I want to follow. That's somebody who I want to emulate.
Yeah.
Well, I know over at Palm Point, you guys just opened up detox. What kind of trends have you guys been seeing lately? I know for us, we see a pretty steady stream of, our veterans coming in for detox, a lot of opiates. But I know you guys are more specialized in alcohol and benzos. What kind of trends have you guys been seeing lately?
Yeah, so it's kind of been around like the age group, if we can identify, it's usually in their 20s to 40s is the average trend of which we have been seeing. And you just see these common denominators. We just posted on our LinkedIn all these common life stressors that you see of like, losing a loved one, or, worry about rent. And there's just the general stressors of life. And, it's great work at what we do, because, we get so caught up in the day, and it's just, we forget to check in with ourselves and just ask, yourself, how am I doing? That's something that personally I've forgot to do in most of my 20s. And it was great. I went to UCF, and they have a counseling center there, and it was fantastic. It was free to students for those up and coming, those who need their masters and so forth. But
that's great.
I didn't realize how much baggage I had, and I was holding on to, especially like I had a father that was in the Marines for 23 years, and he was extremely strict. He was, Captain America, as you could put it. And he had the same expectations for everything. And, I put a lot of stress. I didn't realize how much it was until I had to give a presentation about someone that was important in my life, and I did it on him when he passed away. And I literally, mid-presentation, I literally broke down in the middle of, like, 200 people giving a presentation. And I had to step out, and I didn't realize how much, baggage I had to unveil, and how much I had to rely on other things as to cope with it. Either it was like through drinking or just bad habits in general. And now it's like I actually set a reminder for myself, like at least an hour a day. That's why I usually get up an hour a day just to check in with myself and ask me, like, how am I doing?
I like that
Beautiful.
tip.
I like that.
Yeah, that's really good.
Yeah.
Well, one thing that I learned from you guys recently and have been diving into in my own personal research and studies is that they added a nursing area for new moms. And when we talk about like postpartum depression and psychosis and postpartum substance use, like all of these specialized communities that don't realize that they may not have been predisposed to addiction before, but because of this life event, it turns into you're at a whole other risk.
Right.
And so I know postpartum was one that is at like a higher risk for substance use after. I talked to you briefly before we started recording about bariatric patients and how one glass of wine for them is equal to 4 because of their stomach. So you think about risk populations, what, and feel free anyone answer this, but what do you think has been like the one risk population that you didn't realize till you started working in this?
Good
That's
question.
a good question. Yeah.
That's
Just
a good
because
question.
every day I'm like, man, I didn't think about that.
Well, talking about the postpartum population, they're probably the most undiscovered of it all, right? Because it's, you just had a baby, it's put you over here. And
Probably less likely to seek out care too, because you need.
and you think about all the other lifestyle things that are going on with them, not sleeping,
Yes,
not
you're
eating, right? Probably changes with your spouse just because of the stress. In reality, baby's a beautiful thing. It's also a very stressful thing,
Yes.
right? So it's all of those other parts that change as well. And then there is such shaming today on young moms because of social media
Yeah.
That here's my perfect picture. Here's my perfect family. And life is not that way.
Who's going to step up and say, hi, I'm
really hurting.
Mm-hmm.
Yeah.
Not very many people.
I can't pick my baby up and want to love on my baby.
Yeah. There's
You'll be
so much.
chastised.
And even the mothers that don't even have a support system, they're in it by themselves.
Yeah.
So
Or like what you said about your dad.
Yeah.
You know, if you think my mom was the greatest mom in the world, do I even come close to measuring up? Gosh, have that conversation with your mom, because your mom's going to say, I didn't have a clue either. I was trying to work my way through it, you know?
I
it all
agree.
looks good on the end because it's how many years later? I'm a grandmother now, you know? So it's a lot of years later, but in that time it was like, whoa.
We didn't know what we were doing either.
Yeah.
And full transparency, you know,
Yeah.
you see those beautiful pictures on Instagram, the
Right.
outfit's perfect, the little board saying 2 months, 3 months looks perfect.
Right.
But behind that, there's a mom who probably hasn't washed her hair in 3 days,
Right.
hasn't been out of the house.
Yep.
like
That's
working
tough.
2 or 3 jobs.
Yeah, that
Yeah.
too.
Yeah.
Yeah.
What's
So-
your social life?
It's
It
been
goes down
the
to
beautiful
nothing.
thing about recovery, though, for me, I've seen is that it's people, like when you said, you know, addiction doesn't discriminate, like there's people that come into recovery, or people in my life who said, hey, I got into recovery, and they're people I never thought would struggle with addiction or struggle with substance use. You never know because of the self-medication, sometimes people do function better, even though they're abusing substances.
Yeah.
My best friend has bipolar, and when she was on certain substances, the most stable I've seen her mental health wise. But coming out, like there were certain things that obviously later down the line, as she continued to abuse the substance, it changed into, you know, negative consequences, but she seemed super stable. But I also saw a statistic the other day about 1 in 4 people develop either a permanent or short-term disability in their lifetime. And so when we think about chronic pain too, where something starts as, you know, I'm on this medication to help me, and then they get taken off of it and the pain's still there, how do we navigate that?
That's true. And with our older adults too, I see that a lot of times in our facilities, you know, not wanting to seek out help because of maybe the shame or, you know, and not wanting to come forward where I really have a problem. So I'll get calls from kids in their 20s. Hey, I really want to help my mom. What do I do? She's on this amount of painkillers or what have you.
Yeah.
Do you have any advice for loved ones?
Sure. First off, loneliness is the biggest part of
that's
what
so true.
older folks are dealing with now, and the isolation.
Yeah.
Before we started the podcast, we were talking about checkout lines. And the older folks are the ones who go to where there's actually a human at the checkout line because that's their only interaction of the day. Versus, I'll scan it myself and I'll get out of here really quick. Right?
Yeah.
So loneliness is such a big factor, and we're seeing the addictions rise in the senior population because of that.
Well, substance use spiked during, you know, mid-pandemic because people were alone without any excuse as to why they didn't have to use.
Right.
People were working from home, using more, and it became, you know, I was working in admissions at a treatment facility during mid-COVID, and we had record high admissions because of how insurances were approving detox more. You know, insurance was approving residential more. It became so relevant how intense this crisis has been. And so especially isolation is, it exacerbates the issue so much more.
And historically, for a 3 to 5 year period post any pandemic, we're looking at that anxiety, depression, mental health decline. I mean, Kaiser study just came out with the numbers post-pandemic, 53% of the population diagnosed. You guys know what that means, right? Versus everybody else running around that says, I don't have a problem. 53% with anxiety and depression. Wow. And when you're out in the world, you see how unkind people are to others. And you see that in them. You know, it's the cover up, it's the mask, it's that trying to get through the day and really not being nice to everyone else around them. But we're going to be looking at this for a while.
Yeah. Transitioning back to real world and interacting with people. The world has changed so much. I mean, you could stay in your house maybe more than a week without having to interact to bring your food. You could work from home.
That's the crazy part, about life now. Everything's kind of Blockbuster, for example, right?
Yeah.
Like how the whole philosophy behind that was to go and have the experience and hopefully run into someone in your neighborhood now.
Yes.
And now all of a sudden when Netflix comes on in, now it comes to you. And
so easy.
now everything kind of revolve about everything coming to you instead of you having to go out from it. It's kind of taken away our drive in a sense and taken away that purpose. And now we're seeing the ramifications of that kind of lifestyle.
Yeah.
Well, I feel like addiction is very much about individualism as well. This like self-serving process of I need this despite the consequences for myself and others. And so I feel like as, you know, our society navigates towards that individualism, everyone for themselves, addiction also skyrockets in that same way. Wanted to ask, so in your experience with both working with our community for so long and as a counselor, what kind of things do you see at like a lower level, not at the point where they're detoxing, but where someone might be able to catch it before they reach certain consequences?
Sure. So, the first thing that came to my mind is my mom had. So a lot of my friends have middle schoolers and high schoolers, and they're sneaking vapes. And that's like the first thing that's, you know, a little blip on the radar. And then for some kids, we're cool, we're going to sneak it, we're going to try it. And like we were talking about before, it's the kid who automatically goes to it every single day and is obsessed with finding what they're going to do next. I think where the conversations can start as a family, and being open to being vulnerable and letting your child talk to you openly, I think is a step in the right direction. Like having those discussions and even bringing them up and just saying, hey, you can always talk to me in a non-judgmental space, and whatever it is we talk about, I'm going to help you through it. And I'm going to stand next to you.
Right. Yeah, that's beautiful right there.
The hashtag for Suicide Prevention Month is hashtag be the one to. Like,
oh, I love that.
Be the one to start the conversation, have the conversation. Like these aren't shameful conversations.
And it's tough though. It is so hard. We do an activity on suicide Foundation for Suicide Prevention, and we ask people to ask the person next to them if they have a problem or if they're feeling suicidal. Everyone thinks they can do it, but when you actually turn to someone and you ask a stranger, it can be very uncomfortable.
Sure.
And same thing with addiction, I think, too. But breaking down that stigma and knowing that you're not alone, I think, is helpful.
Yeah, just having like more empathy and like people you interact with, because you don't know what other people's struggles that they're going through. So people are so quick to say like, you know, this person was angry. I remember I worked at McDonald's and this person threw their food at me.
Oh, no.
But I was so. I had to like take myself back, and I'm like, you know, he was an older gentleman. You know, he could have, you know, been told like his wife could have been terminally ill. Who knows? We don't know those struggles, and it's, you know, it's just that perspective of having that understanding of other people's struggles and
absolutely
how important that is. So how much we forget about that.
We forget it, and it's the most basic. I mean, called the golden rule, right? Treat
so
others the way you want to be treated, and we've kind of like forgot about that.
Shani, what really helped you when you were first starting out your journey in recovery? Was there a specific person or something where you were like,
well, it was funny that you mentioned when we all started talking about like, you know, do it for yourself, because for me, I was actually at a meeting last night where the conversation centered around the fact that most of us didn't come into recovery doing it for ourselves. There was like that small 1% of us that cared about ourselves, that also cared about other people in our life and was like, I need to be here for other people. And for me, it was, when we talk about changing our brain, it's also changing our habits, changing, like, I thought a habit was like, oh, I run every day. I like have a good hygiene routine. Habits are so much more than that. It's how do I process? What do I do? How do I start breathing? Do I take intentional time to think through my actions? Those are habits that I didn't think about for a very long time. And so for me, it's diving into, you know, what works for me, especially, you know, recovery is not one size fits all. Especially, you know, the more harm reduction becomes, you know, a trend in our
Can you talk a little bit about what that is for someone who might not know?
Harm reduction is, in definition, the practice of helping people not succumb to fatalities due to substance use. So it's strictly about decreasing fatalities. And Florida's become very pro harm reduction the past couple years. We actually got a study released yesterday that Florida is the only state that's had a decrease in opioid-related overdoses since last year.
Wow. I did not know that.
And so what's cool about that is the fact that, so like harm reduction can be anything from naltrexone, buprenorphine, Vivitrol, Subutex, Sublocade. So those are all different versions of a opioid agonist, antagonist, inhibitors, things that make cravings less and provide kind of that chemical barrier. Sometimes people stay on it for years. Sometimes people stay on it just so that they can get enough of a foundation in recovery. But things like safe injection sites where people can turn in, use needles and get clean ones, where that kind of sounds like enabling in some ways. People that are employed there are in recovery. There's therapists that work there. They're being engaged in conversations about, hey, I've seen you come here every day for so-and-so amount of days. Have you thought about getting clean? They're in that kind of conversation where normally they wouldn't interact with anyone helping them, like if they were using on the streets.
Right.
So I think that has been a huge trend and kind of promoted, people's access to recovery. It's not complete abstinence, one size fits all, which has been great. But for me, it's like, I had a tough week. I knew I had to go to a meeting yesterday, so I went. I knew I didn't want to share, but I shared. I call people. I have to connect with community. When we talk about the individualism, community is what I've heard before. The opposite of addiction is community, because if you're engaged with others, there's not as much of that impulse control, uncontrol, because you're around others and your actions affect others, and you realize that more when you're in a community. So I think that's been huge for me. And now bringing it to my community that got me clean, that's been like working in this field has been what's been driving my recovery for the past 2 years. It's been incredible to be like, hey, I've been in your shoes. I get it.
And I can tell you it means so much to the individuals that we work with too, to have someone come from that perspective. It means a lot to them and it holds so much weight.
Right.
Yeah. No, the importance of peers cannot be overstressed. Peer and community are the two things that I think will change the way we look at addiction.
I agree 100%. Yeah. Is there anything that you want to talk about, Dr. Higgins, that maybe we haven't covered that's like kind of itching?
Forever.
Yeah. Well, you guys do such cool work over there.
Oh, thank you.
I mean, would you mind explaining a little bit more about like the diagnostic test?
Yeah, sure. No problem. I was going to bring it up when you were talking about your friend who, when she was using whatever, felt better. That's kind of what we do is isolate what neurotransmitters, which are your brain chemicals, hormones, how those interact with those neurotransmitters, and then that genetic piece, so single nucleotide polymorphisms, but all that together. So like with your friend, it would be, okay, what did that substance do? What did it affect? Did it affect norepinephrine, dopamine, glutamate, phenylethylalanine? And we can isolate that so we know for this individual, this is what we have to target. Because otherwise it's vocabulary, sounds like, right? And what if we all don't have the same exact definitions of something? In our mind, we think it's something, but we don't know what that other person thinks it is. And that's really what we've been doing, when you think about it. So we have some success, we have not so much success, right? And as this technology evolves that we use, we can see that individual's physiology. So that's what we do. The physiology piece, the psychosocial piece has to be done. But until this point, really the physiology was more like we'd call common sense, right?
Yeah, like
are
the
you
guessing
sleeping?
check.
Yeah, 8 hours a night. Are you having good, dense nutrition? Are you hydrated? Are you staying with buddies who support you? Are you sleeping? Are you exercising? Like that was our biggest science, like serotonin, endorphins, right? There's so much more that we know now. And part of like some of the things that we look at, like the technology to do the genetic portion of it only came about in 2015.
Yeah, that's recent.
Yeah, that's recent history. One of the areas that we look at, Japanese physician won the Nobel Prize in 2017 for understanding how that affects the cell.
Really?
So that's how new all of this is. And to me, the whole thing is that there's such an inequity within mental health and addiction. The mentality, despite what people want to tell you, is you got yourself there. You can get yourself out. We're not spending our resources in helping you with this. That still exists. We can make believe it doesn't all day, but we've got to keep on saying those things. There is an inequity. And every podcast I do, I'm like, there is a real inequity. And we've got to recognize that and open our mouths about that. because it won't change unless we do. And we've got to use technology to advance mental health patients and addiction patients, clients. It's no different than any other part of healthcare.
Yeah, you're so right.
Yeah, that's my, I won't stop saying that because it is still how it's perceived.
Yeah.
And just to add on to that, that's the reason why we added on our substance use detox at that point, because of how there's an equity. But seeing all the patients that do come in that for behavioral health as their primary, seeing that there was a consistent substance abuse secondary and how they were co-occurring.
Right.
So that's why we're like, okay, we're looking at the data and the trends. So that's why we're like, let's put 2 and 2 together. There's an equity, but they're like, they literally run in line with each other.
They are. It's co-occurring. It's, you think about by the time someone's to the addictive stage, a diagnosed condition not being treated properly, an undiagnosed condition, a trauma, 1, 2, or all 3 of those.
So true.
Right? So there's always something at the bottom of it because no one would be reaching outside of themselves to feel better if this all worked.
Yeah. Well, thank you guys for joining us today. I just wanted to see if you guys would be open to going around the room and maybe sharing one thing that is a resource or what brings you hope or something that you're excited for in regards to where we're headed in recovery. Who wants to start?
I'm just really excited just to get the program up and running, and we're seeing a lot more people forthcoming to Palm Point. It's really been taking off quite a bit, and we have like a great team there. Especially,
where's Palm Point?
It's over in Titusville.
Okay.
So about 30 minutes from every major county from either Volusia, Orange, and we serve Central Florida.
Beautiful.
But yeah, we're seeing it's been fantastic. Now we're able to take those quality metrics that we've taken from behavioral health and now implement that for substance use detox. We're just having the same great results. And, we're really excited.
I love that you're able to service a population that there's not many resources for, too.
Absolutely.
You're able to take Medicaid and Medicare, which is really helpful, too.
Accessibility of care is so important.
Yeah.
I think for me, the thing that has been like, I don't know, burning the fire inside in terms of passion is like, I feel like we're navigating, even just in our hospital system and just in society as a whole, towards a more peer and community-oriented, like community-oriented way where it's more than just, hey, here's your next step in treatment.
Right.
It's, hey, here's your next step in treatment. Here's a couple meetings to go to. And it's not just your typical AA or NA. There's smart recovery. There's refuge recovery based on Buddhism practices. There's, I forgot the name of it, but it's like medicated assisted treatment recovery. There's meetings for parents in recovery. There's so many versions and ways to get into recovery and whatever that looks like for you, that there's becoming no excuse to not work on yourself. And so I'm really excited just for the future of what our community really caring about each other looks like. Just because in the past year, I've seen so much change.
That's great.
That's beautiful. What about you, Dr. Higgins?
People have asked me that question, and I'd say, they're like, where do you see this in 5 years? I would say that just like a CBC, when you go for your yearly physical, right, a complete blood count, that you go in and let's see where your white blood cells, your red blood cells, that we do this. So we know everybody's starting point, and they're treated as an individual, and this becomes mainstream and part of what your first line is.
Yeah, I agree. I think I'll leave you all with a little piece of glimmer of hope, too, is for our young kids coming up and their ability to be vulnerable and have these conversations with each other, with their peers. We just did a resource fair with college-age kids, and so open. And I was just floored by the ability to talk about their own mental health, their own substance use struggles, and to help each other out, too. So I'm really encouraged to see our future generation come up in a different way that I did. Right. And I think that gives me a lot of hope. Definitely. Well, thank you all for coming today. And viewers, thank you so much for joining us. We'll see you next time on Mind Matters, and have a wonderful day. Take care.